evening, everybody. Welcome to tonight's webinar sponsored by Brightbod. I'm Kelly Parker. I'm a 8-year breast cancer patient and 3-year metastatic breast cancer patient. So as a reminder, I'm not a doctor, so please don't construe my advice as medical advice. For folks that are not watching live, if you want to ask a question, go ahead and log into brightbod.com and ask the question. The reporters will asking the question there. And then we'll get on and actually answer the question later. So we definitely want to interact with you guys in that way. We plan to have tonight's webinar last about 20 minutes. Last time around I went way long, so I've got my handy timer over here to keep myself on task. And then after that we'll be answering questions and engaging with you guys. That's my favorite part of the presentation tonight, guys, is answering your questions and working with you guys on a one-to-one basis. So thank you for your questions. They're definitely my favorite part. Tonight we're going to talk a little bit about radiation therapy and the ways that we use it to treat cancer cells. Okay. So what is radiation therapy? Well, essentially radiation therapy is a series of high energy charged particles that are used to treat cancer cells and cancerous tumors. So what is a high energy particle? High energy particles consist of alpha particles, beta particles, protons. In most cases, they're going to use gamma rays and X-rays that are accelerated to the point where they actually cause damage to underlying cells, in most cases the cancer cells. And it's used on a wide variety of cancers. So about 50% of all cancer patients at some point in their cancer career will encounter the use of radiation therapy to treat their cancer or treat their symptoms. One of the most common types of radiation includes external beam radiation. External beam radiation is basically using a machine outside of your body to apply radiation to a particular tumor that's located inside your body. And the most common machine that they use is what's called a linear accelerator. And we'll show you a picture of that here in a little bit. Some of the challenges with linear accelerators are that basically they're going to damage good cells and bad cells during the process. So they're going to have to go through your body, for example, to treat a tumor in your breast, or through your body to treat a tumor in your colon, and it's going to cause damage to the good cells as well. The good thing about it is it's fairly localized treatment. So we're talking about keeping things at a local level. Chemotherapy is systemic, but radiation therapy is going to cause some issues at a local level. And the good thing about healthy cells is that you're damaging the DNA of cancer cells, but healthy cells are able to regenerate. So your body tends to recover a little bit faster from radiation than it does chemotherapy, but it's certainly not without its challenges. And I can speak from experience on that. Another kind of radiation therapy that we see commonly in prostate cancer, for example, is what's called internal radiation therapy. So it usually employs the placement of radioactive seeds inside a person, in some cases inside the actual tumor. And it's going to provide a lot more targeted therapy and radiation in that particular area to kill the cancerous tumor without causing as much damage to the healthy surrounding tissues. Another type of internal radiation is actually inserting a wand, effectively, with radiation on it into a body cavity. That could be the vagina, or in some cases the anus, and in some cases the mouth. And it's less applied in those type of situations. But what you see here is a picture of radioactive seeds that are implanted in a gentleman who had prostate cancer. So those are left in there forever, and eventually radioactive decay makes them no longer radioactive, but they continue to work for a period on that prostate cancer and provide minimal side effects and damage to surrounding tissues. It's really the best way to treat prostate cancer in this situation. And the third type of radiation therapy is systemic radiation therapy. So we're actually talking about taking a liquid internally or swallowing pills. And this is actually a radioactive isotope called radioactive iodine, and it's most often used to treat thyroid cancer. So the thyroid naturally absorbs iodine. It's why we have iodized salt actually. And if somebody has thyroid cancer, that pill is going to go directly to that thyroid cell and hopefully treat the cancer until it becomes resistant to that therapy. It does make you radioactive, the latter of those three, and most people that have that treatment actually have to be quarantined for several days, if not more, because it actually can cause damage to other people's thyroid gland, and especially in young children who are still developing. So here's kind of an overview about what radiation consists of. Let's kind of get into a little bit more detail about the treatment process. So how does radiation therapy work? Well, I kind of hinted at this earlier, but essentially radiation is going to create damage to the cell's DNA. And because that particular beam of radiation is targeted exactly at that cancerous tumor, and we're talking to the nanomillimeter degree, they actually do a series of tests and scans to determine the exact point and the exact position that you need to be in so they can make sure radiation is only impacting that particular area. In some cases, they're treating something as small as 3 millimeters. That's tiny. And if you were to move, for example, or they were to miscalculate where that tumor was, they could really cause a lot of damage and miss the cancer altogether. They typically will do tattooing, actually, do a little tiny dot where the tumor is located based on your position under the linear accelerator. And that's where they'll be administering that radiation on a regular basis. In most cases, people receive radiation every single day for a period of about 2 weeks to 6 weeks. And it is a somewhat arduous process. I really thought that radiation is going to be a piece of cake compared to chemotherapy. And radiation kicked my butt. I did radiation for 6 weeks every day of the week. And I had it done to my breastbone. So there's a tumor behind my breastbone and also my axilla, my armpit. The skin was gone. There was no skin left. It was red. It was bloody. It was horrible. But it worked for a time, and it was the best defense to preventing the cancer from spreading further. So, mentioned this earlier, the cancer cells already have damaged DNA. So if we apply radiation to a cancer cell, it can't repair itself. So the idea behind radiation is that we damage the cell's DNA, it doesn't have the ability to repair itself, thereby it dies. And in most cases, that is what happens. Another way that radiation causes cancer cell death is by the creation of free radicals. And free radicals basically generate an oxidative stress environment in the cancer cell. You've heard about free radicals versus antioxidants. It creates an out of balance in that situation where the free radicals actually overtake the cancer cell. And again, it's already damaged because that DNA is damaged and it can't repair itself and it eventually dies. We mentioned this earlier talking about the radioactive iodine with thyroid cancer cells. So in some cases, the cancer cells will actually absorb the radioactive material. They'll take the bait and they will die as a result of that. So that's a really effective way to treat a lot of cancers that do incorporate the radioactive material as a way of functioning. And then we mentioned earlier the radioactive seeds that are typically used for prostate cancer. They essentially give off radiation within that tumor and causing minimal damage to nearby cells. It's certainly not painless and not side effect free. But it's much better than taking an external beam radiation and aiming it at somebody's prostate, where there could be a lot of damage. I mean, we're talking loss of sexual function and infertility in a big way. And there's many men that are younger being diagnosed with prostate cancer. So they're trying to keep that quality of life going and create minimal issues while still effectively treating the cancer cells. All right, so what are the side effects of radiation? I think everybody knows about skin burns. I hinted a minute ago about just how severe they were. I had no skin left, and I've seen people that literally have holes gaping and have to have their wounds packed because radiation causes so much damage. And the thing about it is radiation will continue to work about 2 weeks after treatment. So even after you stop radiation treatment, you will still continue to experience severe burns, and to the point that you can't even really have anything touching it. And the thing that got me through it is that's how I know it's working. So it gave me some peace of mind, and kind of gave me a little bit of strength to keep on going. And when I wanted to quit, many days I wanted to quit and say, I can't do this anymore. Fatigue. So it really depends on where the radiation therapy is being administered. Typically, people that have radiation to the chest, so lung cancer patients, breast cancer patients, some bone cancer patients that have tumors around the rib cage, experience a lot of fatigue, and that's because you're radiating the lungs. There's no way, in some cases, to avoid hitting the lungs. So in my case, my breast cancer was on this side, and the radiation beam came in this way, and there's no way that they could have avoided my lung. They clipped the top part of my right lung upper lobe, and you can still see that on a scan. Actually, you can see the scar tissue. They at one point thought it was cancer, but it was proven to be scar tissue because it's just permanent damage that was caused by the radiation. A condition known as pulmonary pulmonitis essentially gets induced in some cases too, where the lungs actually harden and people have a permanent cough and a permanent breathing problems because the radiation causes damage to the lung. But typically in this area, it's going to cause a lot of fatigue. I actually had to get a handicap license plate for the first time, and I've been on chemotherapy a number of times before. It was pretty embarrassing, but I really didn't realize how much the radiation was going to cause that much fatigue. Nausea as well. People that get radiation in this general area, so the subclavian lymph nodes, the thyroid as well, report some nausea, and also in some cases some mouth sores and some throat sores and the ability to eat, and that's going to lead to the loss of appetite as well. So when people talk about radiation side effects, I really could have made a list that's 50 items long because there's just so many different side effects that it can cause given where it's at. If it's on your abdomen, it could cause stomach issues, and these can be permanent. My mother-in-law had uterine cancer and received radiation to that area, and she still has bowel issues today. So not fun to talk about, obviously, but certainly the reality for a cancer patient, and in some cases the reality for their entire life. So how should I care for my body during radiation therapy? I'm not going to go over every single one of these, but really the key to staying healthy, and even when you're going through cancer treatment, is staying active. Even if you can take a short walk, you will definitely feel better when your body starts to recover. And you'll already be a little bit ahead of the curve when you're done with treatment, so you can stay well, especially during treatment. It's not the time to neglect yourself. It's not the time to eat a bunch of junk food and feel like crap. Talk about getting adequate rest. That's so important. When you're tired, to take a nap. It's especially important during radiation therapy, as your healthy cells that have been damaged by the radiation therapy try to repair themselves. So take it easy on yourself for sure. Ask for help when needed. People don't really know what to do when somebody's going through cancer treatment, and they'll say things like, well, let me know what you need, or I'll do whatever it takes. But if you don't give them what you need and what you specifically need help with, whether it's getting groceries or picking up the kids or whatever, they don't know what to do. So let me know if you need anything doesn't really help, but we can help them be more supportive of us if we give them some additional feedback. Continue to maintain good nutrition. This is especially important as our bodies recover from essentially what is poison to them. And find something that you can relax with, whether it's yoga or journaling or painting or whatever the case may be. Those are really important factors to stay sane and keep some balance as you go through cancer treatment. And then, of course, we mentioned moisturize your skin and make sure that the wounds are covered with protective dressings. There's several different In fact, this is actually a German cure, but there's a cream called calendula that is actually has anti-inflammatory properties and extreme moisturizing properties. And I tried everything, Aquifer and Udder cream and things with urea in it and stuff like that, and nothing really helped the skin. But that calendula cream really made a huge difference. So even if you're not a cancer patient, I think if you research some natural remedies that that may provide some value, it certainly did for me. So during radiation therapy, we often get asked, what are my treatment goals? Like, what do you plan to accomplish with radiation therapy? And just like with chemotherapy, there's a wide array of treatment goals that you have to look at. Most people want to go for the cure, obviously. It's not the case for everybody, but in a curative situation, we're dealing with early stage cancer where it hasn't spread beyond the regional lymph nodes to distant organs or bones. The goal is to eradicate every cancer cell there, basically slash and burn, burn the area all around the tumor and the tumor itself. And they're gonna allow for a higher dose of radiation for a higher amount of time and more treatments, and with the goal to cure. So they're willing to sacrifice some of the short-term quality of life to really try to prevent that cancer from coming back later. Now, in my case, it didn't work, but I couldn't have lived with myself if I just decided to do easy radiation and then it came back anyway. It's certainly something that I'm glad that I did, glad I tried it, and most cancer patients that walk that path probably say the same. In other cases, the goal is to control growth or spread of the cancer for a period of time without symptoms. So this is going to be something like a slower growing cancer of the prostate, metastatic to bone, for example. So metastatic breast cancer and prostate cancer to bone can be very painful. So they, in many cases, will use radiation in those particular areas to alleviate the pain, and they do it at a much smaller dose to not run into a maximum radiation dose over their lifetime anyway. So there's actually a maximum dose that every individual can have of radiation in their life. So you don't want to encounter that if you're dealing with a chronic cancer or a stage 4 cancer scenario. And of course, the goal is to control that cancer over a long period of time. And the last is palliation. So this is palliative care. Again, most often used in the stage 4, the metastatic environment, where the goal is not to cure. The goal is to relieve symptoms and improve quality of life. So we're talking like a very large liver tumor that's creating ascites or fluid in the abdomen for a lung cancer patient or a breast cancer patient. And the idea is, the patient's in a lot of pain, or there's a lot of side effects that they're experiencing. So let's go ahead and get a couple doses of radiation to try to stop that aggressive cancer growth. Maybe the cancer is not responding to chemotherapy or systemic therapy, and it's in some cases it's a last-ditch effort to provide some quality of life to that individual. I just met a person, newly diagnosed metastatic breast cancer patient, a couple of days ago, and she has widespread lesions in her hips and also the top part of her femoral head. So this is the top part of her femur on both sides. And the pain is so excruciating that she can't walk. So she will be undergoing very soon radiation therapy to her hips. And we're talking just a couple of doses of radiation, and it is, in most cases, it relieves all the pain. It stops that cancer from growing so aggressively there, and it allows the bone time to heal. When bones don't have time to heal because that constant tear down and rebuild process is being interrupted by cancer, then you're essentially just setting yourself up for a lifetime of pain, and and there's just no end of it. And she's 30 years old, and she's on fentanyl patches and morphine and just the most aggressive, just crazy drugs, and it's not even taking the edge off of it. So the palliative radiation is really to address pain or relieve symptoms, shorter number of treatments, shorter duration, and much less radiation dose. So that's my presentation. I'm going to go ahead and open it up for questions now.
how long did it take your skin to grow back after your radiation treatment?
That's a great question. Um, I was very fortunate. So I was 31 years old, and I remember when I finished radiation, I had a follow-up appointment 2 weeks later with my radiation oncologist. There's, in most cases, a different oncologist for radiation, a different oncologist for the medical piece of it. And when he removed the gauze that I had still placed on my chest and my armpit, um, he peeled away all the dead skin and saw at that point, just 2 weeks later, it was completely healed. I think I had a lot to do with my age, and maybe it was part the calendula, I'm not sure, but it did not take as long as I was afraid it was going to. Very fortunate that I healed quickly in that respect. 2 weeks.
Okay.
Kelly,
Mm-hmm.
do you have to do anything different with your skin now in terms of, are you sensitive to anything, or do you have to do any special protection or anything like that?
Absolutely. That's a fantastic question. So I hope that, I'm not going to be obscene here, but I want to show you guys something. Can you see the red rash in this general area?
Yeah.
Kind of like the broken blood vessels. That's 4 years old. That's not going away. I am incredibly sensitive to the sun now. I have to use SPF 50 sunscreen to prevent it from burning, because it will actually still burn the exact same outline as my boost that they had put on my chest earlier. So basically it was like a lead template that sat over top of me, and it would treat my entire internal mammary chain with that. So I have to be especially careful that I don't get too much sun exposure, because it causes pretty painful sunburns, and it just not something I want to deal with anymore. So that will be the case for life.
Thank you. One other question, and you may have already answered this with that chart, but if you had to tell somebody was going through radiation therapy and you had to tell them one thing that you thought was the most important thing for them to keep in mind or to do, what do you have any idea what that would be that they should do or keep in mind, or you know?
Absolutely. So I wouldn't wait until you have burning on your skin to start treating it. I did not get out in front of it. I did not pre-moisturize. I waited until I had burning, and then I tried to address it after the fact. I think I would have been a lot more successful if I started from the get-go, when I first thought I was going to get radiation therapy, and really prep my skin for the beating it was about to take. So I think that's critical, no matter where you're getting the radiation therapy.
Okay, great. Thank you.
Absolutely.
Are
Thank
you
you.
aware of any sort of experimental efforts to create radiation that doesn't kill off the good cells and only attacks the cancer in that case?
So that's a really interesting question. I've not seen any evidence of that, but I'm a huge advocate for meditation, mindfulness. I read a lot about mindful meditation. Sometimes being able to control where your mind goes, and bring back take away that negative rumination, because that was almost deadly for me at one point. And bring yourself back to a center. I think that's really, really beneficial. As to whether it does anything to prevent damage to the healthy cells, or has any sort of impact on prognosis, there's some different schools of thought on that. I've seen some information about positive thinking and internalizing good things, and whether that has anything to do with your prognosis. But you know what? I don't think it can hurt. I mean, a lot of my friends that are going through cancer treatments, as stage 4 people always will be, do yoga. They do journaling. They attend different classes that help them express themselves in a meaningful way. So I'm all for it. I mean, complementary therapy is where it's at, And I think we're going to see more and more of that and more evidence behind it. So some of those naysayers will say, okay, I think it makes some sense. Great question.
Kelly.
Yes.
I don't know who's up first.
Marilyn. It's Marilyn.
Go ahead, Marilyn.
How safe is it? How safe is it for you to be among other people? Like, say, once you have had, like, or you're having the radiation. I mean, do you emit any rays, or is it safe to be among other people?
It is. It is a myth that people are radioactive after they receive linear accelerated radiation therapy or the brachytherapy. Now, with the systemic therapy, with the radioactive iodine that we talked about, toward the end of the first slide, you are absolutely radioactive. The entire purpose is that your body is radioactive, so your thyroid can absorb those radioactive isotopes, and thereby the cancer will be killed. So in those situations, you actually have to be quarantined for many days, and not around the general public or anybody, because they can actually have their thyroid damaged by your thyroid's uptake of that radioactive isotope. People actually get a higher dose of radiation when they get a PET scan. So PET scan is a type of scan that basically you receive a radioactive glucose injection, and it then goes to cells that are consuming a high amount of sugar in your body. And in those cases, it's mostly cancer cells, because cancer cells are growing at a very rapid rate. After I get a PET scan every 3 months, I can't be around my 6-year-old daughter for a day, because that radiation that I'm emitting will potentially damage her as she's growing. So, but radiation treatment does not cause any sort of emission of radiation based on what I read and what I understand.
Okay, thank you.
Thanks, Marilyn.
Are you at risk for infections when you go through the radiation therapy?
That's a great question. It does not compromise the immune system, whereas chemotherapy and some of the systemic therapies that we take do. Some people that are receiving whole body radiation for illnesses like leukemia or multiple myeloma, cancers of the blood, cancers of the bone, may see a decrease in the white blood cell count, but for the most part, people that get radiation therapy are not at any greater risk of infection than the general public. It just doesn't impact the overall white blood cell count, the antibodies.
Okay, thank you. I have another question. Are you limited to anything that you can eat, or you can eat just about everything when you're on the therapy?
They don't really have a whole lot of recommendations. They do say more protein, because your body is rebuilding after some of those healthy cells get damaged. If you're getting radiation therapy to any of this region, so the neck, and that's where I had radiation as well, or anything in the GI tract. So we're talking a large portion of your body, right? That can cause a lot of sensitivity to spicy foods, to high-fat foods, stuff like that. So they recommend to keep it bland. And for folks that have radiation to the subclav lymph nodes, I remember I tried to eat a Jimmy John sandwich after I had radiation therapy, and I could not get it down. I couldn't swallow it. So any sort of dry foods, scratchy foods, that it would not happen. And that lasted for about 3 months. So I think that it would be the best bet to keep food soft, not a whole lot of really hard breads and stuff like that. And then if you have anything to the GI tract or the stomach area, stay away from things that are going to irritate your stomach, a whole lot of dairy, for example, because it's only going to end in a bad experience.
Okay, thank you.
Thank you.
Kelly, what if you're allergic to iodine? You said they give the iodine in the radiation for the thyroid.
Mm-hmm.
What if you're allergic to iodine? Do they have a substitute?
If you're allergic to iodine, then they have a couple of new therapies that are immunotherapies that also target fast-growing cells in the thyroid. They haven't hit the market yet. They are in trial. but it is something that they're very much aware of, because it's not just people that can't take the iodine. There's also people that have taken the iodine for many, many years and have gotten a good response out of it, but then they stop having a response to it, and the cancer cells become immune to that particular therapy. So they're thinking about it not just from, I can't take this perspective, but also from people that have taken it and it just doesn't work anymore. They're looking at some stem cell treatments where they're actually targeting the cancer stem cells, which is really the foundation of all cancer to begin with. And looking at thyroid cancer stem cells is something that I'm interested in, because I have some peers at work where I used to work who are living with thyroid cancer. And lastly, they're able to, in some cases, radiate from an external beam perspective, or something called gamma knife. So gamma knife is not a knife at all. Gamma knife is really just gamma rays that are aimed at a very particular tumor location to eradicate in a very particular area. So they also use it in brain metastases and brain cancers, for example, where something very, very tiny off can cause, dramatic issues or even death. So they've had some success treating thyroid cancer with gamma knife and stereostatic needle radiation. They have other options, besides just the iodine, that really is the standard of care in most cases. So people typically start with that if they're able to take it.
Okay, thank you.
Thank you.
Kelly, are there any directives regarding like the intake of alcohol when you're getting radiation therapy or anything like that?
So generally, the recommendation is just to avoid it. It's going to cause dehydration. It doesn't have any nutritional value to it whatsoever. So it also causes, in some cases, burning to your throat if you have radiation in that area. So as you're going through cancer treatment, of course, if there's a special event or whatever, and you want to have a glass of wine, that's certainly not a problem. But in most cases, it's best to avoid that sort of intake until you're done with cancer treatment.
Okay, so it's better to avoid it, but it doesn't have any real negative effect on the therapy as such. Okay. Gotcha.
No.
I have a few questions. The first question is, the radiation may kill much of the cancer, but it may also not kill all of the cancer, and it may leave cancer stem cells, which could then create more cancer. Is that right?
That's absolutely true. Nobody has ever, called radiation the end-all and be-all cure for cancer. It's merely one of those tools in the toolkit to address a malignant situation and to prevent it from spreading. Now, there's no guarantee it's going to happen. I mean, I had radiation, like I said earlier, and I still developed metastases to distant locations in bone. So it's really a crapshoot, and in many cases, it's luck, it's genetics, it's what mutations does your tumor have that allows it to evade treatment and essentially come back time after time despite the most aggressive of therapies.
Yeah, and how do you protect, or how do the doctors protect the heart, the lungs, etc., the other organs, when the radiation is not necessarily close to those vital organs? And then in addition to that, how do the physicians protect the organs when the cancer is right there?
Very good question. So when radiation is administered to an area that's not directly the lung, liver, brain, heart, they will try to protect those organs with a lead sheet. So they essentially will put on top of you a drape that is made out of lead and try to keep radiation from infiltrating places where it doesn't belong. In most cases, it is pretty protective, and it doesn't cause a whole lot of side effects that way. When radiation is needed in your liver, lung, brain, etc., they will try to minimize the damage to that area, but they're not going to be able to keep it from happening altogether. And in some cases, it's a it's just a casualty where they couldn't avoid hitting my lung, for example, when I had radiation therapy on this side of my body. It was one spot. They were willing to take that risk, knowing that it would cause some damage to my lung. In just that one spot, I also lost a breast implant because of that, because the radiation caused a capsular contraction in that area. There's no good answer for how they protect the organs once you have a lesion inside one of them. If it's the liver is going to really regenerate much more quickly. It tends to be a pretty resilient organ. So there's actually even a specific type of radiation that they call Y90 immobilization that they actually insert with a needle, tiny radioactive beads for the liver lesion. It's very successful in some situations for metastatic breast cancer of the liver, and it doesn't cause a total lot of damage to the rest of the liver, just that spot where the lesion is. But they're really still working on how do I protect the rest of the brain, because that's game changing. You could have swelling, and that could lead to death. And in many cases, people with brain lesions actually die because of the radiation. And something else that there's a lot of debate over is the use of steroids to protect the rest of your body as you're going through treatment. So steroids are administered at a high level before treatment and during treatment. In some cases, people's faces that look like mine, a little bit pudgy, end up, and I'm not joking, this wide and this large, because of these steroids cause this massive water retention in what's called moon phase. There's a lot of debate over whether it actually prevents swelling in the brain and whether the quality of life issues and some of the infection risk that occurs are worth it to take those steroids. So we're kind of at a cool point in history where they're looking at, we've said radiation is the right decision. In some cases, radiation actually causes cancer. It has been linked to cancer. I have a friend who had thyroid cancer who later developed metastatic breast cancer. So it's a lot remains to be seen.
Just one more question. The CAT scan is used to diagnose the correct part of the body to administer the radiation. Is that true? The
Yes.
CAT scan?
So they would. Well, there's a variety of different scans that can be utilized to determine where to administer radiation. So
But
CT scan is one of those tests.
But don't those scans
Right.
themselves use radiation?
Every scan uses a small amount of radiation, yes. The highest radiation scans are PET scans, followed by X-rays, and then CT scans, and then MRIs.
So
emit
isn't
very
there?
little radiation.
Oh, so you're the opinion that the small amount of radiation that is transmitted as a result of getting those tests is not a contributing factor and shouldn't be thought of when they're trying to figure out the amount of radiation to give you?
I am. There is some debate over the cost benefit analysis effectively of radiation testing or tests that emit radiation, and whether that's going to have an impact on you later in life. And typically that has a lot to do with younger patients who have a better chance of living longer, and the older you get, the less likely they are to kind of hold back on some of those scans. For example, I'm 32 months without any evidence of disease, so I still get every 4 months a scan to determine what's going on with my body. At 4 years, my oncologist said, if you have no active disease at 4 years, I will recommend that you do scans every 6 months. Now, as a cancer patient, that's terrifying to me, but what he's telling me is that you are exposing yourself to more radiation than what is needed at this time. Right now, the risk to you is higher for more radiation than it would be of your cancer progressing, because I've had such an exceptional response to treatment. So it's really a very personal decision and a commitment with your doctor based on what you guys decide is best for you. I know people that get a scan once a year, because getting scanned every 6 months or every 6 weeks, as some patients do, it's just really opening yourself up to so much more radiation and cell damage. It just doesn't make any sense. We're trying to stop that from happening. And it's better just to, look for symptoms and get a scan as you're symptomatic. All right. That's all the time we have for tonight, guys. So thank you so much for joining. Really appreciate you. Have a great night.
Okay. Good night.
Good night.
All right.
Good night.